11, 12 years old and just enjoying life as if he'd never had any heart problem. Dowda's parents are always returning and giving us pictures, updating us on Dowda's lifestyle. And it brings joy to me to see that he lives a normal life right now.
We couldn't have done it alone. Our partners and donors have been instrumental in our success, providing vital resources and expertise. As we look to the future, we are committed to continuing our mission and expanding our reach. We are exploring new technologies and innovations to improve healthcare outcomes for children across Nigeria. Every child deserves a chance to smile. Let us continue to save little hearts and transform lives together. As we celebrate 10 years of success, we are looking to the future. We are expanding our program to reach even more children and families in need.
We are on a path of making sustainable change within the pediatric cardiac space, within not just Nigeria, but all of Africa. By the grace of God, we will have the first free pediatric cardiac hospital within Africa. That is our goal, that is where our mind is set, and that is what we're going to achieve.
Our team is dedicated to providing the best possible care for our patients. Meet the people who make it all happen. You can be part of this movement. Donate, volunteer, or spread the word. Saving little hearts, transforming lives. Join us in our mission to provide quality healthcare to vulnerable children living with congenital heart defect. Hospitals for Humanity, because every child deserves a chance to thrive.
Morning, everyone.
Good morning, everybody. Good morning, Mrs. Singh.
Good morning. Dr. Moni, good morning.
Good morning, everyone.
Good morning, everybody.
Good morning.
Very well, thank you. Can you see me? Can you hear me? Dr. Moni, please let me know if you can see me.
I can see and hear you perfectly. Thank you.
Very well, good morning. So this is the Hospitals for Humanity third series of our Nurturing Young Hearts webinar. And we are delighted to welcome you all into this webinar today. Today's webinar is in the commemoration of the World Hearts Day that happened yesterday. Every year, September 29th is the World Hearts Day, and Hospitals for Humanity is very delighted to commemorate this day because that's kind of like the biggest of things that we do as an organization. And we want you to know a little more about the hearts of the child and of every little one around you, so you can pay attention and you can note when there is a reason, a requirement to see a doctor, or just provide support for those around you. So today's webinar is going to be very rich and full. We have a number of our panelists already around to let us understand everything we need to know about congenital heart defects. Like we know, and the documentary has just said, congenital heart defect is a condition that is very serious with children, and our focus in Hospitals for Humanity is towards congenital heart defect, which is a subset of the entire heart diseases that could happen with children. We're passionate about children because we believe that no child should be left behind. No child, every child requires to thrive, whether they can afford treatment or not. So today's webinar, like I said, we have a lineup of 5 panelists, and our first panelist today is Dr. Frances Opokurokrok. I apologize if I don't mention that name very well. Dr. Frances, I know that you already forgive me. Dr. Frances is a pediatric cardiologist in Hospitals for Humanity. She is also a consultant pediatrician, University of Uyo Teaching Hospital, Uyo, Akwa Ibom State. She's a graduate of the College of Medicine in Ibadan, and also has a master's in public health from the University of Roehampton, London. Dr. Frances is a honorary consultant pediatrician and a professor at the University of Uyo. And over the years, Dr. Frances has served as a valued member of the Clinical Advisory Board for Hospitals for Humanity. She's very dedicated to her craft, and we are delighted to welcome Dr. Frances as our first speaker in today's webinar.
My name is Dr. Frances Opokurokrok. I'm a pediatric cardiologist. I welcome each and every one of you to today's session. This is World Heart Day, and it's a good time for us to be able to educate ourselves about how to recognize children who have congenital heart abnormalities. This is our outline. We will be looking at an introduction, symptoms, signs. We will conclude and have a look at our references. Congenital heart diseases are abnormalities in the structure of the heart which are present at birth. They are the most common type of birth anomalies that are seen. Globally, the reported prevalence of congenital heart disease has been found to be rising, and it is currently estimated at 9 per 1,000 live births. This rise may be explained by the fact that we have better resources, we have a better ability to be able to detect these cardiac abnormalities than what was previously known in the past. There is a study called the Global Burden of Disease Study, which was conducted in the year 2010, and it estimated that annually over 200,000 children were dying from congenital heart abnormalities in low and middle income countries, of which Nigeria is one. Babies who are born in these areas are more likely to die before their 5th birthday when compared to children who are born in high-income countries. In Nigeria, we have regional differences that have also been demonstrated, with more children being diagnosed with congenital heart diseases in the South, Also, children in the South have been found to have more severe heart defects, and they are younger in age at presentation when compared to children found in the North. Now, these regional differences may also be explained by the fact that we have more resources down south to be able to pick up these children. That is number one. And then number two also, the children that are presenting with more severe cardiac lesions may be a factor of the environment with the prevalence of pollution that has been noted in the Niger Delta region of Nigeria. Congenital heart diseases have been classified into two major categories: acyanotic and cyanotic congenital heart disease. What symptoms do these children present with? First of all, a symptom is what the patient complains about. In other words, for children in this particular instance, if they are younger, it will be what the mother or parents have observed and they come to the doctor to complain about it. Symptoms and signs depend on certain factors. Number one, the type of congenital heart abnormality that is present. Number two, the patient's age. And three, the presence or absence of cardiac decompensation. That is, if the child has developed heart failure. Symptoms that are more prevalent in children who have acyanotic congenital heart disease include easy fatigability. That is, they are very easily tired when they have done just minor tasks. This can easily manifest, especially in the younger age group, by the absence of play. They are not able to play as well and as hard as their contemporaries. They also fail to thrive. They are not growing as they ought to. They may also present with episodes of cough. For children who have cyanotic congenital heart disease, on the other hand, more predominant symptoms include bluish discoloration of the lips and of the tongue. Now, I want to lay an emphasis here. In people who are dark-skinned, you may not readily be able to assess the presence of cyanosis from the color of their lips because their lips may be dark in color. So the best place to look for cyanosis is on the tongue, and it usually looks like a dark purplish color. Other associated symptoms include frequent squatting. Now, squatting is a mechanism that the child develops to compensate for his inability to receive enough oxygenation in his blood. So when the child squats, that brings more blood into the lungs, and that blood is more readily oxygenated, and that improves the patient's symptoms. They are also usually short of breath, as I had earlier mentioned. If we look at symptomatology in terms of the age, in infants and younger children, they have feeding difficulties. So what happens is that they are pausing frequently in between breastfeeding to rest. For a baby, the child finds it difficult to be able to suckle straight ahead without any breaks in between. They also sweat excessively. This excessive sweating is a symptom of the presence of a congenital cardiac abnormality. This is particularly important where in an environment where you don't expect the child to be sweating. For instance, the weather is cool. Why would the child be sweating? They also tend to have repeated chest infections. And this is what we call bronchopneumonia. Now, when bronchopneumonia is associated with wheezing in particular, it is found to be more common in infants and younger children who have congenital heart abnormalities. These children also fail to thrive. They are not growing very well. And in fact, in some instances, that may be the only symptom that the child is presenting with. The fact that he cannot be compared in size to children who are his contemporaries. In older children, There may be a history of fainting spells, what we call syncopal attacks. They also fail to thrive. They are not growing very well. And then if that child has decompensated, the reverse is the case, that they may now experience excessive weight gain with leg swelling, abdominal swelling, and facial puffiness. This is usually seen when the child has developed heart failure. There is also abdominal swelling, as I had earlier stated, and they may also experience pain, usually on the right side of the abdomen. Signs. What are signs? Signs are what is observed by the doctor when the patient is examined. So when we inspect this child, what are the features that we expect to see in the general physical appearance of the child? They are usually small for age. We may also see that they are sweating excessively. We may find that they are breathless or dyspneic. How do you recognize a child who is breathless? You will notice that as the child breathes in and out, the nostrils are flaring, there is chest indrawing. These are all evidence that the child is breathless. They may also have what we call dysmorphic features. What do we mean by dysmorphic features? Features that do not look very normal, looking at the child physically. Now, when certain features are noticed and they appear as a constellation of features, we usually realize that there may be a syndrome that is present. For instance, children who have Down syndrome, they present with a particular set of physical characteristics which the doctor will observe. Furthermore, as we inspect, the child may be found to be pale. They may also be cyanosed. We've talked about cyanosis earlier. They may have finger clubbing, where the fingers appear spoon-shaped. The fingers and the nails appear spoon-shaped. They may also have leg swelling or pedal edema. When we palpate or touch, examining the cardiovascular system, and we palpate the pulse may be faster than normal, and this usually happens when the child has gone into heart failure. When we auscultate and we listen to the heart sounds, we also find out that the heart rate is very fast. So the pulse rate is fast. When we check the blood pressure may be increased. It may be elevated in some types of congenital cardiac anomalies. For example, in the one we call coarctation of the aorta. Examination of the precordium may reveal a hyperactive precordium. What do we mean by the precordium? The precordium is the area of the anterior chest wall that overlies the heart. So looking at it, you may find that the cardiac impulse is very clearly visible. The heartbeat, it's like a samba playing or a drum playing, okay? So there may also be bulging of the anterior chest wall, of the sternum, because of an underlying enlargement of the heart. When we palpate the precordium also, we may detect what is called a thrill. A thrill is a palpable murmur. I will explain what a murmur is shortly. Palpation of the abdomen would reveal a tender and an enlarged liver, and then there may be presence of fluid in the peritoneum, what we call ascites, and there may also be the presence of pedal edema. Let me emphasize a bit on this pedal edema. It is usually seen in older children. That is number one. It may be found around the ankles, and depending on the severity, may actually spread up to the knees and beyond. When we percuss, percussion helps us to detect the presence of fluid also in the lung pleura. The pleura is a membrane that covers the lungs, and it has a small space with a little fluid. But when the child goes into heart failure and begins to retain a lot of fluid, then we may find fluid inside the pleural space surrounding the lungs. A percussion also helps us to determine or assess the degree of ascites and the degree of liver size. Auscultation is when we listen with our stethoscopes, and majorly auscultation helps us to detect abnormal sounds like what is called a murmur. Murmurs are that we hear when we listen with our stethoscope. It is usually due to turbulent flow, usually blood flowing across diseased valves or flowing through heart defects, defects in the walls separating the upper chambers of the heart, the so-called atrial septal defects, or defects located in the lower part of the chambers of the heart, in the wall that separates the lower chambers of the heart, the so-called ventricular septal defects. So when a murmur is heard, it usually signifies that there is turbulence in flow. But I want us to take note here that murmurs can also be innocent. There may be no underlying pathology to an innocent murmur. On the other hand, also, a patient may have significant congenital cardiac abnormalities and may not have a murmur on auscultation. These are all the things that the doctor, the patient's pediatric cardiologist, will be able to elicit when examining these children. In summary, the spectrum of congenital heart disease in children ranges from mild to severe to critical. These lesions are better diagnosed early with a view to initiating treatment, which may be medical, surgical, or both. Early recognition is of paramount importance in helping to mitigate the effects, that is the morbidity and the mortality that arises from this clinical condition. These are my references, and I thank you all for listening.
Hello, can everybody hear me? Oh, I'm sorry about that. I was muted for a moment. Good day, everyone. I want to welcome you again, even as my co-host, Ms. Isioma, has already welcomed us. But welcome today to this webinar that's commemorating the World Heart Day. Thank you, Dr. Francis, for that very illusory lecture. So just some information about the World Heart Day. It was first started in 2000. So this is the 24th edition of the World Heart Day. It was started by the World Heart Federation in concert with the World Health Organization to be able to bring more awareness about heart issues. About 17 billion people die every year from heart cardiovascular issues. So the initiative was to spotlight heart issues so that we could do more to bring this to light and to come up with more solutions. The theme for this day, this year, 2024, I should say, is Use Your Heart for Action. So hopefully with all the different information that we're able to give here, everybody can find different ways to use their heart for action and shine more light on the issues with heart issues. We at Hospitals for Humanity do focus on children's heart defects specifically. So we talk a lot about congenital heart defects, but today we'll also talk about other heart issues that affect children, both acquired heart disease as well as affects other people as well. So I want to go ahead and start by introducing our next speaker. I'm gonna wait for that profile to come up. Thank you so much. So Mrs. Moreni Keji Lawal is our next speaker. She's a clinical advisory board member for Hospitals for Humanity. She's a registered critical care nurse at Emory Healthcare in Atlanta in the United States of America. She's a seasoned healthcare professional with over 25 years of experience in the nursing field. Her expertise encompasses providing treatment, developing care plans, and delivering intensive care during emergencies. She specializes in adult acute care, and she has a huge passion for caring for vulnerable populations, and which is why she's involved with us at Hospitals for Humanity. She has a Bachelor's of Science in Nursing and a Master's of Science in Nursing Leadership and Healthcare Administration from Grand Canyon University in Arizona. Outside of her professional pursuit, she likes leisurely walks. She's been involved with us since 2016, and she's been dedicated to medical missions, partnering with us to fulfill her purpose and serve others as well.
My name is Morenike Lawal. I am a registered nurse by profession, and I hold the position of hospital as a nurse administrator for Hospitals for Humanity. Happy World Earth Day to everybody out there. We do not only serve the children, but we also provide healthcare for the people all over the world, adults included. I hold a professional license in registered nurse. I've been practicing for many years now, maybe approximately 25 years. But my first background is actually respiratory therapist. And I guess this is what made me to qualify to speak about this topic that we're about to talk about today, which is pulse oximetry. So pulse oximetry best practice is what I'm about to speak about today. In everything that we do, especially in measurement of values in science, we have to have a means of measuring information adequately and accurately. Pulse oximetry is one of the measurements that we use in determining the right amount of oxygenation in our body system. This can be measured in different ways. We have different parts of body parts where we can get this information. Pulse oximeter must definitely be applied to an area where the circulation is adequate in the body. We tend to go for the peripheral system, part of the body like our fingers, our toes. But sometimes we have patients who are very compromised, cardiopulmonary issues. So it's hard when the fingers are cold, when the toes are cold. We can measure this number, the oxygen number in our red blood cells by using our earlobe right here. We also can measure on the forehead, when we do the search, especially when we have a patient that is compromised, cold. I currently practice in healthcare system in the ICU, and I see patients who are very compromised that it's very hard for us to get circulation from them. So we go for the earlobe or the forehead. How do we define? We define pulse oximeter measurement as a device that measures the amount of oxygen in person's blood or the oxygen saturation. This device is a small device. You can see the picture in my slide. That's a beautiful color, by the way. It's one of my favorite colors. It comes in different color. It's non-invasive. It's a clip that goes on the finger. The one that goes on the earlobe looks like a bandage. It's a small bandage. I didn't have the picture here. Maybe it's a small bandage. It goes into the area that you want to apply it to. And this really, really measures the oxygen level to that portion of the area. And the oxygen level can also be measured on the patient, like I explained to you before, in an extreme cases where we have problems with patients who are not perfusing, adequately, the fingers or to the toes. So we do it in the ears. The device is used, in the patient, and it's a device that has like a red infrared technique to it. apply it to the finger, and the red part has to go on the flesh part. The fingernail is the other part that that you can measure it from. There are different set of numbers that is acceptable for our patients. It's normally it ranges between 95 to 100%. Just like anything, if you get 95 out of 100, you're doing good. So if your oxygen level, when you use your pulse oximetry, especially at home, if it's 95 to 100, you're doing fine. Your doctor's supposed to have established a set of values for you. If you're going to measure this at home, I need to mention that. And if you see a big deviation from such number, we advise you to please inform your doctor or your provider so they can look into what's changed in your system. Sometimes the device might be you, or you don't want to take that into your own hands and just determine not to do anything about it. So if you see any variation in your normal number, please let your doctor know. We have patients with different health issues like AFib, which is atrial fibrillation. Atrial fibrillation is a situation where the heart is just clicking and it's not transfusing adequately the blood to the system. And we can see a different number in such patients. This patient, of course, needs to be managed by medications. That's aside from this situation that we're talking about. COPD, which is the another problem where there is breathing issues with our elderly patients, especially. Emphysema is another thing that affects the lungs. The COPD affects the lungs, emphysema affects the lungs. And of course, my favorite part, which is the congenital heart defect, where we come into play, HIV comes into play, because it's the population that we take care of. I know in our babies who are with the congenital heart defects, our doctors, fantastic doctors, they know we established that these kids do not fall into the norm. So the measurement is totally different. And sometimes it's even specific to the disease that these children are dealing with. So that's different. Now, in a general setting, for us to measure this pulse oximetry in our patient, education is very important. Just like anything that we do, when we educate our families, our patients, the loved ones, in anything, the education I tend to increase the compliance, right? Of anything that if you know why you're doing something, you tend to want to abide by the rule and regulation of such thing religiously. So we need to educate our families, our children, our patients, the reason why they need to have this device at home. It's portable. Anybody can even find it. It's almost everywhere now. Even in our situation in Nigeria, we've seen them all around. It's very important for us to educate them on the proper technique and how to use it. So we know that we can adequately treat our patients, if we see the variations that is life-sustaining, so to say. So correct application to the body part, when we apply this piece of device that I've shown the picture in my the previous slide, it has to fit tightly, not too tight, but snugly to the body parts that we're trying to measure from. We need to ensure that the body parts that we're using, like the fingers or the toes or the ears, that dry to touch. We don't want it to be wet. First of all, and we need to make sure that we prevent other issues. So it needs to be a dry surface. And when we apply the device to the finger, we need to make sure that our patient's part, the body part, is below the heart level. And of course, the gravity helps with the perfusion. We need to ensure in the female patient that they do not have nail polish. Nail polish causes the interference from the device to the skin, right? So we need to make sure that our patient's fingers are clean, no nail polish, dry, and they're ready to measure accurately. The science to that is the emitter and the probe. It's on the finger side, while the sensor is on the other side. And while we're reading, we need not to jump quickly into our first reading that we see, because it's a wave reading. We need to wait about 1 minute, 60 seconds. This is what we advise our patient, so the reading can take the average number and then give us a number that we're looking for. HFH served kids. We serve pediatric children is whom we deal with. They're very, very special being, category of patients. So we have a whole different kind of, settings, for our children, or they need to be, sometimes we deal with them with gentle touch, with love. So when we are applying to the infants, we need to secure the sensor to their great toe. When you see these devices, the one that I showed you might not even be applicable to our little tiny children, but the bandage looking one can be applied. It will be more accurate. We attach it to their toes because these babies, they move a lot. And when they move, movements sometimes interfere with the accurate reading, the results. So we attach it tightly, nicely, not to cut off the circulation from the great toe. So we use the great toe to do the reading in children. We secure it. We can also use the index finger. Really, we're just looking for the part of the body. Then we can wrap this bandage looking like thing to nicely so we can get the reading that we want. We also need to make sure that the sensors are not, we cover the sensors where we're using it during the phototherapy, the warmers, because sometimes we have the baby incubators, heat source, anything that can interfere with the accurate reading. We want to make sure that we avoid it in our children. It's very sensitive to treat these children, right? They were already coming in with compromised, cardiopulmonary, system. So any slight mistake or any error in reading can affect our treatment plan for them, and we just need to make sure that we avoid that. It's safe for us not to measure the earlobe or the bridge of the nose from the infant or the toddler, just because the skin is very fragile. So we want to make sure that we're not doing damage, because that thing has a heat system to it. The device has the heat system. So we're trying to stay away from the earlobe in our children, and we don't even want to do the nose, and we don't want to do the forehead, just to prevent breakage in the body of the children. So protect them, our neonates, protect our pediatrics, protect any fragility surface to them, and hopefully we can get the accurate reading on these kids. I just want to thank you. Safety is very important. These things work with the batteries most of the time, but when we're in the hospital settings, of course, we plug it, we have our electric source. But this pulse oximeter, the portable one, has really played a very great role in measuring, in helping our children, in treating them at home, in them detecting, when there is a change. So this thing, when it goes home with the babies and their family, the children, it works with batteries. Make sure that we teach our families and the children and the patient, if they're able to help themselves, to make sure that they check the batteries very regularly. And if it needs to be changed, they need to change it. They need to keep the device clean, because if the surface area is dirty and there's a decay or anything that is interfering the communication from the machine, from the little device to the skin, it's bound to have an error result, and we do not want to do that. If there is any breakage in the lining, please notify your doctors, the provider, the nurse, anybody. If another one needs to be obtained, we need to quickly do that. Thank you so very much for your time. I hope the information that I brought this morning has really added value or information to what we've already known. It's a very popular device out there. And happy World Heart Day again. Thank you, and God bless.
Thank you, Mrs. Maranike. We appreciate that wonderful, very simplified way that we all can actually just keep alert and just be in check, ensuring that every child around us, and even older children and older people, can detect if something is going wrong at any time with the heart. Right about now, we will take a personal story. And I think Dr. Moni has dropped in the chat room. We would love to take questions now. We want you to send in your questions. We already have 2 speakers that have come up. and we want to take your questions now. Please drop your questions in the chat box. We will be taking them during the question and answer session. We would love to take one of the very personal stories that we have at Hospitals for Humanity. We have numerous stories of children that have been touched and blessed by the work that we do with our partners, and we want to share that with you. We'll take Okon Niabasi's story, and then we would have the next panelist come up. I'll come back to introduce the next panelist. Thank you.
My name is Mrs. Uimabasi Savior Okon, and this is my daughter, Iniabasi Savior Okon, my first daughter. We are from Akwa Ibom, Ikotambo. We came from Ikotambo, Nibesipo, Asuta, in Akwa Ibom State. So we had of this surgery from our consultant, Dr. Consultant Francis. She was the one that informed us, and she also encouraged us to bring her here. Then I asked her some certain questions, which she said if she is not going to be operated, that the future shall be worse than this. So I have to summon courage and trust in the Lord, because in God all things are possible. And I now brought her down here. The first time I noticed these symptoms was when she was about 3 months. That was the first time at Calabar Teaching Hospital. They took echo tests. The doctor now informed us that there was nothing wrong with her. When we came back down to Akwa Ibom State, that was between 7 to 8 months. She had the symptom again. I now took her to the hospital. The echo test was conducted again. That was when we discovered that she had a little problem on her chest. My daughter Iniabasi went for surgery yesterday, which was Wednesday, and the surgery was successful. She came out today, and I saw her. She was strong, healthy. I'm so happy. Secondly, I'm grateful to the Almighty God, whom I put my trust in, and He did not disappoint me. I'm so grateful to the Almighty God and to this great organization, whom have pity and mercy upon the little kids. May God bless them all in Jesus' name.
Thank you all for staying on with us. I hope you enjoyed watching Iniabasi's success story. Though that's one of the many stories of change lives that we do in Hospitals for Humanity, with support from all of our amazing doctors, pediatricians, consultants, surgeons, everyone that works together with us, and our partners. We cannot do that without the support of our partners, and we are so grateful for that support that we receive from everyone who partners and continues to partner with Hospitals for Humanity. We will take very quickly our next panelist, who happens to be the Director of Cardiology in consultant, director in Hospitals for Humanity, director and consultant of pediatric cardiology in Hospitals for Humanity. Can we take his, can we have it now up? Dr. Wale Olabiyi is our Director of Pediatric Cardiology at Hospitals for Humanity. He's also Chief Medical Director at Pediatric Cardiology Consultants of South Texas, USA. He's a brilliant and dedicated pediatric cardiology, and he possesses, proficiency in cardiovascular outcomes research, and is a member of the Pediatric Cardiology Consultants of South Texas. Dr. Wale's professional interest encompasses inpatient pediatric cardiology and in non-invasive imaging. He maintains a particular focus on the single ventricle program and the transition of the cardiology care from pediatrics to adulthood. Dr. Wale is a very, very committed member of the Clinical Advisory Board of the Hospitals for Humanity, and we are very happy to welcome him to take the next session of the webinar.
Good day, everyone. My name is Dr. Olawale Olabiyi. I'm a pediatric cardiologist. Welcome to Nurturing Young Hearts. In collaboration with Hospitals for Humanities and Access Bank, we'd like to say to you. And we look forward to you joining us today for our series of lectures on Nurturing Young Hearts. In our Nurturing Young Hearts series, we're going to be talking today about leveraging telemedicine for remote congenital heart disease screening. For the agenda today, we're going to explore the exciting potential of telemedicine to transform congenital heart disease screening and care, particularly in underserved environments. We're going to explore some of the barriers to congenital heart disease screening, the advantages of telemedicine for remote screening, the current technologies for congenital heart disease screening in the telemedicine space, establishing secure and reliable telemedicine connections, and also we're going to look at some privacy and data current issues. Barriers to traditional congenital heart disease screening includes limited access. In areas where a patient or a referring physician is quite remote, and there's lack of specialized healthcare such as pediatric cardiology, those areas pose some significant challenges to accessing congenital heart disease screening. For those patients who live far away, it is very costly for them to travel to centers of excellence or tertiary centers to get specialized care. So that can be very burdensome for them, especially if they're coming for an appointment to get screening done versus coming for surgery. So it would be good if there's a way for them to get their screenings done, even though they live far away. There's a lack of trained pediatric cardiologists all over the world, and definitely in remote areas. And this limits the availability of that expertise to diagnose congenital heart disease. With the limited specialties we have and the scheduling difficulties, this starts to give us a time crunch in diagnosing our patient with congenital heart disease, because some of these things have to be diagnosed within the first few months of life. We can't wait till years or when it's too late and it's hard for things to be done. So it's essential that we get that congenital heart disease screening done as soon as possible. The advantages of telemedicine for remote screening is that it definitely increases your accessibility. It takes and helps us to bridge that gap that the geography had caused, and it bridges that gap and enables us to have access to specialized healthcare, particularly in our case, congenital heart disease screening services, for remote populations. So it can reduce the cost of travel, and it actually does significantly reduce the cost of travel because people don't have to travel from their remote locations, either in the village or in their secondary centers of excellence. They don't have to travel all the way to a big institution to get their screening done. And it also improves the efficiency because if you need more frequent follow-ups, that can be done locally where they are. And then that information, you can use it to make changes in the patient's care and then have follow-ups again. So to reduce the access to care, to reduce wait time, to reduce the time to diagnosis, and to reduce the time to intervention. So the type of telemedicine technologies that we have for congenital heart disease screening includes digital imaging and conferencing. We could take the transmission of high-resolution images of echocardiograms. For instance, if an echocardiogram is done in a remote section of, take any particular state in Nigeria, Kano, or in Uyo on the extremes of Uyo. Let's say an echo is done there, and that echo is now sent out to a pediatric cardiologist in Abuja and Lagos or other parts of the world. That image can now be transmitted to them, including the electrocardiogram or any other diagnostic tests, without having to send a disc or without the patient having to come there. And then that information can now be reviewed, and then we can conference over. You can also do real-time, which we do a lot with HFH, real-time video consultations where, for instance, I'll be over here in the United States, and we'll have a patient in a remote part of Nigeria with their primary care provider, and we'll have a video conference with the primary care provider and the patient. And we can review the patient's clinical scenario. We can review the current diagnosis and help to facilitate the care and diagnosis from then on. We can also have remote monitoring devices, things that patients can wear and take home, like Holter monitors, which are monitors that you wear on your chests that helps to record the electrical activity of the chest. And some of these Holter monitors or event monitors can be evaluated real time, remotely, to see if something is going on with that patient at that particular time. At the same time, while we are doing our remote consultation with a primary care provider and a patient, if there's someone who can obtain echocardiograms or some imaging information, we can help to guide how the acquisition of that data is obtained. So if there's an echo being done or an ultrasound that has been performed from a remote location, we can guide how that ultrasound is being obtained to get some clear images or to get portions of the images that might have not been previously obtained. So the advantage of telemedicine is that patient does not have to travel all the way to Abuja, Lagos, or the United States to get that screening performed. They're at home and that screening is being performed there. If there is strong electronic health records, like an EMR system, you can also real-time share information through EMRs. That sometimes is a difficulty because the facilities have to collaborate and communicate effectively between themselves. But if that's available, that is also great. One of the key things for telemedicine and diagnosing congenital heart disease, especially if you want to do something that is live and real time, is high-speed internet. Having reliable and fast internet connections is essential for seamless video conferencing and data transfer, especially if it's live. If it's live, you can have some hiccups in between the obtaining of data. So it is essential that we try to get high-speed internet even in the remote areas, which sometimes can be the issue. So in that situation, it might be better to just have the echo obtained, have the EKG obtained, and have that data set, and then we can review it. Cybersecurity is important. We have to make sure that whatever we're sending through comes through a secure and encrypted format so that the information can't be broken into, or we're keeping the patient's information HIPAA compliant in terms of all the medical information that we're obtaining and diagnosing. So if you can integrate telemedicine into an existing healthcare system, it helps really to make that process seamless. So we have some platforms like Doximity that allows some seamless integration with existing health records and other healthcare systems. If that's available, It really makes the workflow system efficient and allows for smooth transitions between traditional and telemedicine consultations. You have to train the staff on using these telemedicine technologies and the best practices for using them to make sure that you have a successful implementation. Patient privacy and data security. Over in the United States, we have the Health Insurance Portability and Accountability Act, which pretty much ensures that it's confidentiality and security of patient health information. We're taking that also when we do our telemedicine work internationally to make sure that we're securing patient data and it doesn't go into the wrong hands. Hence, we try to do data encryption, and store our data in safeguard methods to avoid any kind of unauthorized access and data breaches. We limit access of the data that's obtained only to the people that need to be. It doesn't go to everyone in the entire organization. It's only people that need to have access to the imaging or the EKG or the patient files that have access to it. That limits where the patient information goes and increases the data security. In training healthcare providers for telemedicine consultations, first and foremost, the person has to have that clinical expertise. But the advantage of the telemedicine and advantage of diagnosing this congenital heart diseases, over remote means is that we can develop good streamlined communication platforms where learning platforms are set, where providers can come and learn from other providers who might have more specialized skills. Then they can grow their own clinical expertise in congenital heart disease diagnosis. And then when we have a remote live stream, that information that they learned previously, they can build on it on that live stream. So we try to train our collaborating partners on using telemedicine platforms, on how to use the video conferencing software and remote monitoring devices. And we continue to try to work on communication and effective communications amongst all our providers. Some areas, and it's coming up in Nigeria too, we have to make sure that we're keeping up with all regulatory approvals. We are keeping up with having our providers being licensed, and we're keeping up with the current regulations in regulations for telemedicine and licensing and on all those things. In some places, you can get reimbursed for doing telemedicine. However, in low and middle income communities, the availability of insurance is lacking, and so there's not much reimbursement that you can get from that. Maybe in the future that can help out in the future, but right now it's just not available. So we hope that people can advocate with the government, with the local government, with their boards and local governments and even the federal government to get policy changes that will support telemedicine in diagnosing congenital heart disease and other kinds of medical conditions. Because like we talked about earlier, it's actually cost effective to do this, brings access to care to those people. It helps in diagnosing those things earlier and then preventing further problems in the future. Transforming international congenital heart disease screening. It helps us to get that access to care to people who need it and improves that. And it also optimizes the outcomes for the patients, as we talked about. As the technology advances and the internet access is more regularly available, telemedicine is poised to play an important role, a pivotal role in the future of congenital heart disease care across the globe. At HFH, and in conjunction with Access Bank, we do hope to broaden the reach of pediatric cardiac screening to places that were previously unreachable. Together, we can change the outcome. Thank you very much.
Thank you so much, Dr. Wali Alabi, for that very insightful talk. Okay. I'm sorry, I just wanted to make sure that I specifically introduce myself. My wonderful co-host has said my name, but I'm Dr. Maniko Akomo, and I'm a pediatric cardiologist and global development clinician with Hospitals for Humanity. Thank you again for joining us on this World Heart Day webinar. As I've said before, the theme for this year is Use Your Heart for Action. So definitely, as we're going through these different wonderful talks, we should think about how we want to do that. One of the things that has been specified is, getting your heart checked at regular intervals. The second thing would be staying fit and healthy, eating healthy as well, and staying active and doing exercise to keep your heart healthy. The third thing is doing seminars, which is what we're doing today. So we're so excited to be a part of spreading this awareness to combat cardiovascular diseases, which, like I've said, unfortunately, take about 17 million lives every year. We're hoping to continue to be part of that change. I want to introduce our next speaker. If they can bring up our speaker profile. Thank you. Okay, so Dr. Queenette Daniels, she's our Assistant Director of Pediatric Cardiology for Hospitals for Humanity. She's also the lead pediatric cardiologist at Federal Medical Center in Kefi, Nasarawa, Nigeria. She is a highly qualified pediatrician specializing in pediatric cardiology. She completed her medical degree and residency training in Nigeria, and she had her master's degree in pediatric cardiology from the University of Padova in Italy. She has extensive experience in managing patients with heart diseases, both congenital and acquired, at various medical centers across Nigeria. She teaches and supervises residents in pediatric cardiology at the Federal Medical Center in Kefi. Her areas of interest include non-invasive imaging, fetal echo, and interventional cardiology. Please welcome Dr. Daniels. Thank you.
Good afternoon, everybody. My name is Queenette Daniels. I'm a pediatric cardiologist, and I welcome all of you to Nurturing the Young Hearts in conjunction with Hospitals for Humanity and Access Bank. I'll be talking about the critical role of early diagnosis in the management of congenital heart disease. We've already learned what congenital heart disease is, and we know that is a major cause of morbidity and mortality in children, and the incidence is increasing worldwide. Early diagnosis plays a very important role in managing these children, and it can be carried out in various stages, starting from the fetal period, infancy, childhood, and during the school age. The important role of early diagnosis is that it helps in comprehensive management of these children, right from prevention to the surgery and up to the time of even rehabilitation after surgery, because surgery does just not end the process. Now, what are the roles of early diagnosis? Early diagnosis, especially through the prenatal care period or at birth, is essential for referrals to centers that can provide timely treatment. There are centers where you have pediatric cardiologists, the cardiothoracic surgeons, everybody on ground. And so making early diagnosis and referring to them early enough can save the life, prevent adverse consequences, which invariably can be of disability or can even lead to death. So early diagnosis during the prenatal period is very important. It's also very ideal through the prenatal period to have early diagnosis. This is because there are numerous babies with congenital heart disease that have very good prognosis if they're operated on in a timely manner. Studies in Australia have shown about 50% reduction in the incidence of congenital heart disease because they're able to detect early and intervene early. Now, also early prevention also helps in carrying along the families. Knowing that you have a child with congenital heart disease you've carried for 9 good months can be a devastating problem. It can be very painful. And so preparing the families, preparing the couples, even the environment is of extreme importance. This helps them in taking informed decision. It also helps in giving them support. So early diagnosis is critical. It's also important because it gives the possibility of treating disease with fewer invasive treatment to better quality the life of these children. There are children that have complex heart diseases, and they are dot dependent. Just diagnosing them early and getting them ready to get things like prostaglandins early enough can keep their life going until an intervention or a definitive surgery is done. And this also is important because it reduces the long-term healthcare costs for both the family and individuals, and also the healthcare where these children are born. So early diagnosis, its role cannot be overemphasized. It allows for timely intervention, and this prevents the progression of health diseases and reduces the risk of complications that can occur. HIV tetralogy of Fallot, for example, if detected early, can prevent all the cyanotic spells. If it's gotten early and intervention done early, you can prevent all the cyanotic spells. You can prevent all the increased blood levels that can result in releasing thrombus and causing a stroke. So early intervention, early diagnosis and early intervention resulting from early diagnosis play an important role. Early diagnosis too helps individuals make lifestyle changes and receive appropriate treatment for managing their conditions effectively. A child that is diagnosed early with large VSDs and ASD, you know one of the major complications you're about to face is a congestive heart failure. So giving medication early can help this child wait until surgery is accessible. Good nutrition plays a role because most times when you get these children, they are severely malnourished. But if you get, most times when they're malnourished, we just take it that, oh, it's nutritional problem and we're running around nutritional problem. But if we diagnose that this failure to thrive is as a result or how congenital heart disease has a role, and this is detected on time, then supplements can be given to these children early enough. Advices on how the mother can prevent direct breastfeeding and help with cup and spoon feeding and all that can help keep these children in good health condition and good nutritional status until they are able to achieve surgery. So in overall, early detection, early diagnosis plays a critical role in management of children with congenital heart disease. And this can be implemented step by step, allowing congenital heart disease to be detected early and to prevent severe clinical manifestation. Thank you.
Thank you, Dr. Quina Daniels, for your talk. The importance of early detection of congenital heart defects and any heart issue, to be honest, it cannot be overstated. So thank you. That was a very important talk. I would like to go ahead and introduce our next speaker. If they can bring up the profile for me, please. Thank you. While that comes up, I'll start. Our next speaker is Professor Chris Yilgren. He's a pediatric cardiologist associated with Hospitals for Humanity. He's also the Chief Medical Director for Plateau State Specialist Hospital in Jos, Nigeria. He's a distinguished pediatric expert, serving as Professor of Pediatrics and Child Health and leading the Maternal and Child Health Research Unit at WACEID, which I learned is the West African, I think it's an important teaching point. It's the West African Center for Emerging Infectious Diseases. He has a strong academic background, extremely strong academic background. He specializes in clinical and epidemiological research, particularly in maternal and infant outcomes, cardiovascular health, and congenital heart diseases. Professor Yilgwan also holds the role of Chief Medical Director at the Plateau State Specialist Hospital in Jos, Nigeria. His multifaceted contribution to make him a respected figure in pediatrics and child health. And I'll have to say also on the world stage. So we're very happy to have Professor Chris Yilgwan speaking for us today. Thank you.
Good day, listeners and all who have joined this webinar. I'm Professor Christopher Sabu Yilgwan. I work and reside in Jos, Nigeria. I'm a pediatric cardiologist with the University of Jos and currently work as the Chief Medical Director of the Plateau State Specialist Hospital. I'm going to take some time to talk to us about heart disease prevention, risk factors, and proactive measures. I hope that on this World Heart Day, it will help us, prioritize our life and also our activities in order to help stem the rising tide of cardiovascular diseases. So happy World Heart Day to everyone who is on this webinar. Thank you. So, like I said, I'm going to be looking at the risk factors and proactive measures that we need to take in order to improve on our cardiovascular health. So, as a way of introduction, I'm going to be taking us through the burden of heart disease globally, both in adults and in children. Globally, about 17.8 million deaths that occur globally occur from cardiovascular diseases or cardiovascular related deaths. And more than 75% of those deaths actually occur in low and middle income countries where the resources and the capabilities for treating and also for preventing disease are limited or virtually lacking. Diabetes, hypertension, high cholesterol, physical inactivity, renal diseases are some of the things that have helped to push this high burden of cardiovascular diseases globally. And it is projected that in the next 20 to 40 years, the burden would actually more than double, especially in the Western developed countries such as the United States of America. In children, rheumatic heart disease is the most prevalent acquired heart disease globally, though it is more common, in low and middle income countries. Rheumatic heart disease is virtually preventable because it results from sore throats, which can easily be treated. But when either poorly treated or untreated, it may result into rheumatic fever and eventually rheumatic heart disease if it will occur or repeat itself. In the child population too, we know that congenital heart disease is still very much around with us, and the burden is not reducing. We have more births, especially in developing countries, and those births, may result into congenital heart disease. And we all know that the resources and the competencies for treating congenital heart disease is not as readily available in those developing countries as they are, in the more high-income developed countries of the world, such as UK, France, and the United States. Now, what are some of those factors that predispose to cardiovascular disease? I'm going to be helping us to look at those factors that we can do something about, especially those that can be modified with behavioral change and also by policy changes and policy implementation globally. So, like I mentioned earlier on, physical inactivity is the most common risk factor predisposing to cardiovascular disease. It accounts for almost 31%, in one of the series, that was done by the Global Burden of Disease. The other risk factor is where people eat foods that are rich in cholesterol, food that are rich in refined sugars, foods, that make diabetogenic, or foods that are obesogenic. It tends to increase the risks of heart disease. And coupled with that is the increasing incidence and prevalence of overweight and obesity. And this, together, with alcohol and tobacco smoke, seem to increase more than twofold the risk of cardiovascular disease. It is projected that in the next 2 to 4 decades, if things are not done to address these modifiable risk factors of cardiovascular disease, the chances are, that the burden of cardiovascular disease may increase by more than 50% globally. Now, what are some of the prevention strategies that we can put in place? First, I would like us to look at these strategies in the light of the social determinants of health model. We're going to be looking at these strategies at the individual level, the interpersonal level, the community level, and also things that we can do at the level of government and at the level of policy. Now, to look at these prevention strategies, first, there are factors that are more prevalent at the population level, and those factors are usually outside the control of the individual. And for us to be able to address those factors, we may need, to look at issues, at the population, level. For instance, when you look at policies that may need to target, public smoking, and thankfully most countries, have put in legislation, issues around health promotion, issues around taxes, especially where some people call them sin tax, that tend to increase the tax on some of those luxury, goods like tobacco, alcohol, that tend to increase the risk of cardiovascular disease. I will also need to look at issues, around the environment, the way the environment is built, especially, environmental factors that limit for physical activity. Okay, so we look at the way the streets, are designed. We look at security, gun violence, and all those things that may, affect or prevent people from going out to exercise or from going out to take a walk. And we know that those people who walk tend to have less weight and less, obese, and we know that obesity and physical activity are some of the most important causes of cardiovascular disease. Again, we may look at issues, around primary prevention, where we target the individual behavior. So we're looking at individual behavioral modification, strategies. For instance, we could target individuals using the internet with messages, that tend to promote, the uptake, of, behaviors that tend to improve, their cardiovascular health. For instance, we could target, teenagers or young people, with smoking cessation messages. We target young people with weight loss, strategies. We could also target, people who surf the internet, with messages that tend to improve their dietary choices, messages that try to limit or reduce, the chances and the desire to take junk food, sugary food, all those soda drinks and all that. Again, we could use the social media, other social media for health promotion. We can also do hybrids, approaches, where apart from, the technology, and social media, we can target individuals with individual messages that would help them, take on those strategies that can help improve their health. Again, we can use group, therapies, for people who are trying to lose weight, group therapies for people who are trying to cut down or to reduce their intake of soda and sugar, which we know when you add that to physical inactivity, it increases weights and obesity, and we know that obesity and increased weights are some of the key factors that predispose not just to cardiovascular disease, but even to diabetes, which also have an increased, tendency to predispose to cardiovascular disease. Now, for people who already have hypertension, we can target them with messages that tend to help them reduce their blood pressure. For instance, we can target them with messages that help them to avoid sodium-containing foods, or to reduce their salt in their meals, or to reduce their salt intake in food, especially junk food. We can also, prescribe, drugs that would help to reduce the blood pressure. We can also, target people who have diabetes, either with pharmacological as drugs to help control the diabetes, or with even, messages, that help, in improving their behavior, and also in improving their adherence to their drugs, because we know that adherence to drug helps to reduce the blood glucose, and when blood glucose control is good, it reduces the risk of cardiovascular diseases. Now, if you don't remember anything in all the things I've said, you should be able to remember that one, smoking is a very important cardiovascular risk, and smoke cessation, especially, for those who already have other risk factors, would be important in reducing the risks to cardiovascular disease. More exercise, and when we talk about exercise, it must not be aerobic exercise. It could just be brisk walk early in the morning, later in the evening after work. Any walk that helps you break out sweating, or that helps to increase your heart rate, would help you burn calories, and that would help reduce your weight. We know that with reduction in weight, we improve your cardiovascular health and reduce the risks of developing cardiovascular disease. We also have talked about weight reduction, and then healthy diet, and lastly, good sleep would also reduce the risk of cardiovascular disease. So thank you very much for listening. We want to wish you a happy World Heart Day 2024. And remember, a good heart keeps your life going and keeps your brain working. So go out there, improve your heart health by exercising, stop smoking, and take healthy diets to improve your heart health. Thank you.
Amazing. Thank you so much, Professor Chris Yogwan, for that amazing session. We've had an amazing time of learning. I just dropped with behind the scene that I've totally enjoyed this webinar, most from all of the webinars that we have done. And I just love the fact that it's very relatable to everyone. One of the things that Professor Chris talked about was sleep, and exercise. Some people think sleep is overrated, but sleep is important for your heart health. And that's what Professor Yoguan has just told us. And we need to exercise, work bricks working, just get out and keep your heart healthy. I also recall that my co-host, Dr. Omonigo, had mentioned earlier that the theme of, I just want to reiterate for those that didn't join us pretty early, the theme of this year's World Heart Day is, what did she call it again? 1 minute, give me it. Dr. Omonigo, could you want to help a sister?
Sure, it's use your heart for action.
Using your heart for action, right? So every one of us, can we put our hands on our hearts so that we can feel the heartbeat? Can you just put your hand on your heart? Your heart is beating. Every beat of your heart means something, and you must put it to action. We must now begin to allow the very heartbeats that we feel to move us to take action about children all over the world that are suffering from heart defects, children all over the world, and even adults, everyone just going through a difficult time because they don't know if they will breathe another breath, deep breath in and out because of their heart defects. And so onto that, we would be taking another success story, an amazing success story that I like to say is made possible by the support of our amazing sponsors. And this particular one, I think, is one of the many children that Access Corporation has supported us to reach out to. Would like to take the story of Ewa Davids right now. And after that story, I'll be back. Thank you.
My name is Mrs. Maria Ewa, and my son's name is Master Davis Omakamsi Ewa. We are from Ebonyi State, Nigeria. When he was born, I think the people that were taking care of him, the nurses, they noticed he had a murmur. And so they sent us for further investigation after 2 months. It was when we went for the investigation, we did echo scan, that it was discovered he had 2 holes in his heart. And since then, they now had to place him on anti-heart failure. So he has been on it. We're supposed to repeat the echo scan after 6 months. But for one reason or the other, we did not do it until February this year, when he was having breathing difficulties and all whatnot. So they had to send us out of the hospital to do it somewhere else when the hospital cannot do it. It was there that the doctor that did the echo discovered that we had to go for surgery. And then the doctor that did the echo now told us that there is these people that will be coming in May. She will try and include his name in the list. If he's selected, then he will call us, she will call us for the surgery. And lo and behold, because I kept checking on her, because the result actually showed that his heart might collapse any moment. That showed. And so I had to be calling and calling until eventually, last week or last week, she called me that they will be coming this month, and that she prays that he will be selected. Eventually they called that he was selected, and that is why we are here. My expectation is that after this surgery, that the child, this Omakamsi Davis, will run like his siblings. He will be able to play like them. All the cough, you know, all those things that trouble him in the night, because the most important is in the night, when he's sleeping in the night, that he will not be breathing and putting one into the emotional cruise that one was experiencing. I expect him to be normal and to grow properly, even like his mates. Yeah, I have seen my son after the surgery. The surgery was successful, and to the glory of God, the boy is recuperating very fast. He's doing very well, and I'm very excited about it. I'm very excited seeing that the boy will now be free, knowing that he will be free eventually, that he's now free, so to say. It was like, in fact, it's like a dream. As if I'm even dreaming, so to say, because just a few months ago, I didn't know that I will be a partaker of this type of thing. You know, even when we were talking about it initially, somebody was like, is it not? You know, because it's not easy for you to get such thing. But I give God all the glory that eventually it came true. I don't know how to thank Hospitals for Humanity. I don't really know how to express my gratitude to them, but I know that God himself will keep paying them. He will reward them wherever those people that are partnering with them and they are providing the funds for this. I pray that the Almighty God will bless them, both from the doctors, those from abroad, those within Nigeria, the nurses, you know, the hospital assistants, the pharmacists, as many of you that God is using to do this job. God will bless all of you. I'm very grateful. Thank you so much.
Awesome. Thank you so much for watching. I hope that, you know, that video, that clip of Ewa David's story, success story, can inspire all of us in this room to do more. Our desire is that every child that has congenital heart defects should thrive. We do not believe that any child, because his or our parents do not have the funding, should be left to die because they cannot treat themselves or have access to treatment for congenital heart defects. And, you know, away from that, very quickly, someone very important is in the room, and we want to, like I said, that success story couldn't have been achieved without the support of our dear partner, also incidentally partners with us on the webinar, Access Corporation. So we have in the room today, and we would have to speak to us very briefly, the head corporate communications, Access Bank Ghana. We would have Mr. Oluwaseun David Akindele come up to speak with us.
All right, thank you. Thank you, Isioma. I hope you can hear me clearly, and hopefully you can see me as well.
Very well.
Awesome, awesome. Thank you, Isioma. And I think the last speaker, if I'm correct, Mr. Monigo. It's a very important topic we discussed here today, and I'm very happy to be here joining us. So as we reach the close of this impactful webinar, I want to sincerely thank all of you, each one of you, for your commitment to this important cause. Together with the Hospitals for Humanity, Access Bank has been working to make a tangible difference in the fight against congenital heart disease. And today's session has just reinforced the importance of that mission that we have. This partnership now in steady year has enabled us to, of course, support life-saving congenital heart surgeries for children and and train medical professionals on the heart disease detection and care. But this isn't just about numbers, honestly. It's about lives transformed. Lives have transformed through this exercise. And while we celebrate these achievements, the real work lies ahead. There's a lot of work we need to do, all of us. Raising awareness, of course, driving early detection, of course, and advocating for proactive care must remain our ongoing focus. Congenital heart disease should not be met with reactionary measures. It demands prevention and very early intervention. What we've learned here today is not just information. I can assure you that. It's a call to action for every one of us here. Each of us has a responsibility to take this knowledge and apply it within your communities, shared with your families, your friends, and your connections, and with your loved ones as well. Advocate for screening, emphasize the importance of awareness, and support organizations dedicated to this cause. At Access Bank, we are deeply connected to the issues that affect our communities, passionately about it as well. Our commitment goes beyond financial support. It extends to action, advocacy, and awareness. As we live today, let's not lose the momentum. Honestly, I think it's a direct call to all of us. Our strength lies in our unity to fight this together. We can push for real change, ensuring more lives are saved and more future secured. In line with the theme of World Heart Day 2024, use your heart for action. Let us each take a step forward towards making a difference, whether through raising awareness, supporting prevention, or advocating for better care. We all have a role to play. Thank you once again for your participation and dedication. Let's continue to bring light to this issue and ensure every heart receives the care it deserves. Thank you and have a good day.
Thank you, Mr. Oluwaseun. God bless you. And we extend our warm regards to Access Corporation and for all that you and the great management has been doing the last 3 years. We hope that, you know, together we'll continue to make a difference, one heart at a time. Thank you so much. We'll take.
Thank you too.
Thank you. Just as we step into almost rounding off, we want to take our questions. We have some questions that have already come in. If you have yours, please drop them on, you know, in the chat room. We will take those questions immediately, and we will start with the questions that have already been taken. This kind of might be the last time you see my face. Just to remind you, my name is Isioma Success Olubenga, and I'm Senior Development Strategist at Hospitals for Humanity. My co-host will take it from here, and in a short while after answering the questions, we would be closing. So please bear with us, and we would soon be closing the webinar. Thank you.
Hey everyone, so now it's time for the interactive section of the webinar, and we're very eager to hear any questions that might have come up in listening to all the wonderful information that our panelists had to share. While I wait for questions to come up, or even if somebody wanted to indicate and they could be unmuted so they could give their questions live. I'm just going to let you know that on average, your heart has 115,000 beats per day. Just an interesting heart fact. Please feel free to drop your questions in the chat box. Or like I said, you can unmute or at least indicate, and then our facilitator can unmute you so that you can ask your questions. Yes, the questions need to be put in the chat box for our panelists to address them. Okay, so while we're waiting for people to put their questions in the chat box so that we can see them and the panelists can address them, I have a question for Dr. Labi, who talked about telemedicine. He's still on. Yes, I just wanted to find out, and I think you talked about this a little bit, but I know that in at least in the in areas abroad, they have a lot more opportunities at harnessing telemedicine initiatives to, help patients. How do you think in places, underserved places, specifically in a habitat place like Nigeria, how can we better position ourselves to be able to make use of these telemedicine initiatives? Often we think about things like network, even when you're trying to make calls or do things online. Do you have any tips about how the health professionals in that access of the world can be able to better position themselves to be able to harness telemedicine initiatives to help the patients? But I know access to care is a huge problem, especially something like for kids with congenital heart defects. How can they better position themselves so that they can the patients can benefit from that technology?
So for those places with remote access, I don't know if you can hear me. Yeah, I think so. Can you hear me, Dr. Mo? Okay. For those places with remote access, it will be better served probably for those areas to have the non-synchronous telemedicine options if there's not good Wi-Fi access. So for instance, if you don't have good internet access, then you might want to record the echocardiogram and then send that afterwards versus doing a live recording, because the live recordings requires you to have good high-speed internet. And if you're remote, you might not have access to that. I think as technology becomes more available and you have more people that have access to, cell phones and things like that, we've done some telemedicine stuff with kind of like a Zoom call on a cell phone using like things like doximity, just so that the information is encrypted. And that just requires a phone to do it. So that's one other thing we've done before for some continuous synchronous data acquisition is while you're trying to acquire the EKG or trying to acquire the echo, I could be over here in the US and work with my counterpart in Nigeria, and they're doing the echo and I'm giving instructions on different things like that, on how to obtain the images. But the online, synchronous at the same time, going from one computer to the next sometimes can be a little bit of an adventure. So if you don't have good high-speed internet, maybe you acquire the image, then you send it. We make sure we have that image, we look at it, and then we can now collaborate and talk about a plan. But once again, as there's more access nowadays throughout Nigeria, throughout other parts of the world, with phone access, then I think that kind of opens up the ability for us to do some more telemedicine things. I hope that answers the question.
Yes, thank you. Thank you. That's a great answer to that question. I believe there's some other questions coming in. Sorry, just a moment while I pull this up. Okay, I'm not sure they typed the full question. Mr. Daniel, I'm sorry, your question doesn't seem to be complete. Okay, I think maybe I can try to imagine what they meant to say. I think the question is thank you for correcting that. How does Hospitals for Humanities PCTSI program contribute to addressing these challenges? They weren't specific about the challenges meant in this question. But if it was the telemedicine part that was meant, I believe well, I don't know if you want to say more, Dr. Levy, about what we specifically do with Hospitals for Humanity to address that challenge specifically. I know you spoke about things generally, but I think they want to know about what our program is doing specifically.
So our program is, like I said, specifically, we are working with partners over in different parts of the world to help facilitate and look at, images and help patients that are remote. I don't know if what he meant particularly to address those challenges. We're not a telecom company. We're not going to be able to provide high-speed internet for the person. So that we can't do, but we can work with people that are remote, and as they see patients, as they find patients that are 6 hours from the center, and they send that image to us, we can then communicate with them on the best things to do. Okay, I think he has more to that question, but yeah, I think, maybe somebody else can take that part. Okay, yeah, Dr. Daniels or Dr. Francis, I think this would be great questions for you guys, based on what he's asking now. It's not a telemedicine thing. I will step down. Thank you.
Thank you, Dr. Levy. Some more questions are coming in. I'm just going to read this one that's next from Tomiwa Alake. It says, thank you for the amazing and highly informative session. I'm a community pharmacist and I'd love to know how and if I can volunteer my services. So thank you, Tomiwa. We definitely love having volunteers. We have volunteers in different sections. From being a community pharmacist, we definitely need and love pharmacists and need their assistance. And if they have any other background or any other interest, it's something that we can explore with our volunteer coordinator. So we'll take your information and we'll reach out to you so that we can get you plugged in. Thank you for that. Next, from Vanessa, what role can the general public play in supporting congenital heart disease initiatives beyond donations? That's another great question. Let me see if I can get you somebody to answer for you. Definitely. Dr. Quinette, Dr. Daniels, do you want to take that one? From Vanessa.
Can you read the question again?
What role can the general public play in supporting CHD initiatives beyond donations?
Okay, so like we've discussed, we've said that one major role is early detection and referrals. So the general public, I mean, you see somebody, you see a child, or you have a family member whose child is not growing or showing some funny symptoms and all that you do not understand. I think you can refer that child to the hospital as soon as you can. And if they've already told you that this child has a heart defect, you can always reach out, help to refer this patient to a center where they have cardiologists or pediatric cardiologists. And that way you also be helping, because most of these children, for financial reasons, might not just go to the hospital. And so that's why we're not even detecting them very fast. By the time they're coming down with terrible complications. Some deliver at home, some stay at home and all that. So as a person, a layman in the society, when you get this kind of cases, you can contact, as you're already in contact with Hospital for Humanity, or you're in contact with any of the cardiologists anywhere, you can help refer this patient. You can also help talk to them and give them hope. Sometimes just mere talking can give hope. You give them hope that, look, there are places where these defects can be handled without you being rich, without you having all the money. And if you go early, you can get saved. So that's one of the ways I think the community can help, instead of just letting them stay at home. And then also, we can also speak, advocate. Some of the general public also know all the emirs, the rich people in the community, the various people that can help. Even if you don't have the money to donate, you can help in getting or reaching out. Sometimes we give them this echo report. Some of them we ask for funds and all that. And you come across it, you're in contact with the media. You can also help, advocate for this children or people that have congenital heart disease without actually donating. So in that way, yeah, you can be putting in part of your own contribution. Thank you.
Thank you, Dr. Daniels. That was a great answer. If any other panelists want to add more to that, let me know. But I think, like she said, advocacy is very important, and everybody has a voice. Next, I have another question going down. Okay. It says, I'd like to know, and Dr. Francis, if you could take this, I'd like to know, please, what are the key challenges currently faced in the process of fighting against congenital heart defects, particularly in under-resourced regions? Dr. Francis?
Yeah, good afternoon once again. Can you hear me?
Yes, we can hear you perfectly.
Okay. Yeah. Thank you for the opportunity to answer that question. We have a whole lot of challenges in resource-challenged areas, of which, unfortunately, we find ourselves in Nigeria, belonging to that region. So one of the most important challenges here would be the issue of funding. Funding is, cardiac surgery is very capital intensive, and also because of the type of healthcare systems that we operate here, which is based on mainly out-of-pocket expenditure. So it's a very big problem for parents of children with congenital heart diseases to be able to access sufficient funding, even for the most basic of investigations, even the primary screening alone. So this is one of the major challenges that we face in managing these children. That's number one. Secondly, let me also reiterate the issue of early diagnosis. In our environment, we have to deal with a lot of superstitions and a lot of myths. So you have parents of these children who, for instance, maybe a child who has recurrent episodes of cough and is being treated for bronchopneumonia, and the child is being taken to all sorts of places. And as the child now deteriorates further, they are now told, oh, this is not a disease for the hospital. And so we find out that late presentation is another very important challenge. They end up coming to hospital very late, and at which point little or nothing can be done for them. So these are one or two of the major challenges that we face, the issues of ignorance, superstition, myths that would lead to late presentation, and also the issue of funding. Thank you.
Thank you, Dr. Francis. I would like to invite Dr. Daniels to take this next question, since she talked on early detection. Are all congenital heart defects detectable during pregnancy, and if so, how? And then I believe there's a sub-question to that. Dr. Daniels?
Okay, so yes, most, I wouldn't say all, but most congenital heart disease can be detected. Starting, like I said, from the prenatal, you have using your fetal echo. In fact, you start with the gynecologist that first of all, do the abnormally scan, and they just notice something is abnormal, something is not right, and then you can be sent to do a fetal echo. And most fetal echo can detect major congenital heart diseases. And then when you're done with fetal echo at birth, the nurse had said, simple use of the pulse oximeter can help, because you have cyanosis. The pulse oximetry has been shown to detect at least up to 80% of cyanotic heart diseases. Just knowing that a child is desaturating and it's not doing well, even when you put on oxygen and you put on your SATs at early stage, that tells you, oh, something is wrong here. It's just not a respiratory problem alone, or it's not a respiratory problem at all. So why not go and do your heart and go and do your echocardiography? With echo, you're looking straight into the heart, and so you're seeing structurally all the problems that heart has. So to at least a large extent, early diagnosis can detect major congenital heart disease with some of these simple procedures. I hope I've answered that question.
Yes. Thank you, Dr. Daniels. That was a great answer. Like you said, a lot of the major ones can be found before delivery. A lot of times you have to confirm after delivery, so not a lot of times, all the time. And speaking of superstitions, I know some people have some which may try to prevent them from seeking, the fetal echocardiography before delivery, but the fetal echocardiography has no adverse impact to the mother or the baby. It's just helping to check so they can be prepared for if there is a problem. I have another Shulamet Ayele. We will reach out to you. We're capturing your information. So we'll reach out to you. Next question by Regina James. Please facilitate or take note of Shulamet Ayele's request. For Regina James, good day everyone. Please can the sleep hygiene be explained? Thank you for joining us and asking a question, Regina. Let me see if Dr. Chris is here still. Okay. Unfortunately, I think the panelist who gave that talk is no longer on. Dr. Lavi, do you think you could talk a little bit on sleep hygiene and the importance in heart health? Dr. Labi. We will come back to that question. Another Prof. Etioma, thank you, is interested in knowing how doctors can hook up for diagnostic assistance in congenital heart diseases irrespective of location. So I believe that's again referring to telemedicine. Dr. Labi, are you available to speak more on that? I think he's talked about different modalities. Dr. Labi, do you have anything more to say on that? Okay, we'll move on to another question in case he comes back. Another question that came along with the question about pregnancy is if congenital heart defects can be prevented. I don't know, Dr. Francis, if you have anything to say on that. Dr. Francis? Sorry, you're muted if you're speaking, Dr. Francis. We can't hear you. Thank you.
Okay, can you hear me?
Yes, yes, thank you.
Okay, congenital heart diseases usually arise as a result of an interaction between genetic factors and certain environmental factors. Okay, so maybe for the genetic factors, we may not be able to do too much about that, except the fact that early screening, genetic screening, genetic counseling, if it's been known that in a certain family, there are certain, they've had a child before, or a parent or a sibling has had a congenital cardiac abnormality before, then the importance of genetic counseling and genetic screening comes in. So early screening, early diagnosis is very important here. But for certain environmental factors, sometimes pregnant women are exposed to infections, certain viral infections in pregnancies, that's one. Some of them may be exposed to certain drugs. So in these circumstances, what it would be good, the advice to give to a pregnant woman would be as much as is possible to avoid things in the environment that could contribute as a factor towards developing congenital heart diseases. In some instances, people who live in areas with masts with high radiation, for instance, these are all factors. And then even in the Niger Delta too, the pollution that has been found in the environment from petroleum degradation and products has also been implicated in the higher incidence of congenital heart defects that are seen in that region. So these are some of the environmental things that we need to be conscious about, and perhaps we can take steps to prevent as much as is possible. Thank you.
Perfect. Thank you so much, Dr. Francis. Amazing answer. I have just a few questions left before we were able to wrap up. Somebody asked about how volunteer involvement has impacted the success of the past PCT-SI programs, and I can just say from experience, volunteer impact is, volunteers are what make the world go round in regards to our program. So to answer that question, we couldn't do all the things that we do to help all the children that we help without the involvement of passionate and dedicated volunteers. And people can get involved if they're interested. We can reach out to them, and we also have our information. Our website is hospitalsforhumanity.org, so you can also connect that way. Circling back to some of the questions that were asked before, Dr. Dennis, I don't know if you can say anything about sleep hygiene to help out Regina James, since Dr. Chris is no longer online. Dr. Daniels?
Sorry, what did you say about sleep hygiene? Sorry, what's the question? I can't hear.
Sorry. The question was about how sleep hygiene helps with heart health. I believe Dr. Prof. Yogan had talked a little bit about that in his
helps mental health, or helps what?
Helps heart health, cardiovascular health.
Oh, okay. Okay. Unfortunately, the speaker has disappeared or is not available.
Yeah.
But yes, you need sleep for several reasons. Sleep hygiene is very important. When you have a heart disease, you need to have enough rest in order to allow your heart to function and for you to grow. Most times children are not able to grow because, yes, I know the disease can kind of affect them, but when they're able to sleep well, it allows the heart to function in a good environment and also enables them to grow. So sleep, it's very important. You remove the stress. Let's even say in older children, the rheumatic heart diseases and all that, you need sleep to remove stress. Because when you're stressed out, you overwork your heart, and when your heart is overworked, your other systems are not going to function better because the heart is what supplies all parts of the body and organs and all that. So when you're stressing the heart, you're kind of stressing all parts of the body. And so sleep in its first helps, the heart function adequately, even in a disease situation. I think that's the little I can add to it. Thank you.
Thank you. That's very helpful, Dr. Daniels. Also think about how when you have lack of sleep or people prolonged insomnia have higher blood pressures, and that can also have its impact on the heart function and thickness. So definitely, sleep hygiene is very critical. I have one more question, I believe. I don't know if Dr. Labi is available now. If you wanted to add anything about how doctors can hook up for diagnostic assistance in congenital heart diseases irrespective of location. I know you talked about this already. I don't know if you had anything more to add. Prof. Etiuma was asking this question.
So can you hear me now?
Yes.
Okay, awesome. Yeah, so yes, you can reach out to us on the HFH website, and you can reach out in any of the doctors that work with us can help you. I can, Dr. Omanigbo can. So if you reach out to us and you do have patients that you are working with that you have questions about, in terms like the diagnosis, or in terms of treatment protocols or plans. So we do that a lot with a lot of physicians, practitioners across the country, where they have a patient, they have a question about a diagnosis, and we can help with that diagnosis and confirming that diagnosis or changing some things if need be. And then if you have a simple question like, okay, when should this child have surgery? We can help with that. Okay, this child needs to have surgery between the ages of 4 and 6 months old, because if you wait till 1 year old, it can cause X, Y, and Z problems that might not be repairable. So, like other, I think Dr. Francis was talking about this. It's important to diagnose early, and catch things early so we can make an impact. So I think if you have a question, just reach out to us, and we'll work to help diagnose a patient and help to plan a treatment a treatment plan, either surgical, cath intervention, or medical, if it's just medications that are needed. So there are different ways we can help out. Now, also on the question about sleep hygiene, it's good for kids. It's also good for adults. If you are not sleeping well, and you're an adult, and you are living on 2 to 4 hours of sleep a day because you're trying to make money, you're stressing a lot, that stress can build up over time. Like Dr. Omanigbo said, it can build up over time and release different chemicals in your body that put you at risk for like heart attacks and things like that. So getting good amount of sleep at night, it's hard for us to sleep for 8 hours, because we're busy, but we have to try and get it done so that we can rest our bodies well, rest our heart well, rest all the different organs, so that one is not counteracting with another, causing different problems in different places, especially with the heart. If you don't sleep well, after a while, it can affect your lungs also. If you have like sleep apnea, if you're waking up too much through the night, if you're overweight and you can't sleep well from sleep apnea, and lots of different things that can occur with that. So getting adequate sleep and getting good sleep is definitely important in overall heart health for kids and also for adults. I wish Dr. Chris was here to delve more into that, but I just wanted to say 1 or 2 things about that. Thank you very much.
Thank you so much, Dr. Wabi. So this was going to conclude our question and answer session. I am going to pivot now. I would like to welcome our very own pharmacist, Okbayemi. He's the Hospitals for Humanity country coordinator. And sorry, let's get up his profile. So he began his journey with HFH in 2016 as a volunteer first, and then transitioned to a full-time clinical pharmacist position. He's become lead pharmacist and is also now an executive member of the organization. He has extensive experience and dedication within HFH, and this has equipped him with a broad range of skills and insights, making him exceptionally suitable for his role as country administrator. His journey through various roles within the organization has provided him with a comprehensive understanding of the operational, clinical, and strategic aspects of HFH, ensuring his effectiveness and success in his current position. Please welcome Pharmacist Okbayemi with me. Thank you.
Good day, everyone. I want to believe you can hear me very loud and clear. Okay, thank you so much. So it's been very wonderful being in this webinar since morning, and we've quite learned a lot of things from different presenters, and we're very grateful for every one of us. I'll like by shouting a great hooray to Hospitals for Humanity. Now, if you're not aware, let it be very known to you that this year makes it the 10 years of Hospitals for Humanity doing great things in Nigeria. So we call it a decade of saving little hearts. It's a wonderful, wonderful experience. We've been able to do a lot of surgeries by the help of the Almighty God. It's unwavering grace and strength for each of the team members. And through his guidance, we've been able to provide life-saving surgeries to countless children in Nigeria. Of course, from Abuja to Jos to Uyo back to Abuja. We went to Kefi. From Kefi, we went back to Abuja. And of course, we're looking towards going to another place now. It has been a great time of adventure, of saving little hearts in Nigeria. We've sounded the alarm to a lot of people. Now some parents are aware of what this defect looks like. They are cognizance of the signs and symptoms. We've screened children, we've mended several hearts, and in short, we've been able to restore hope to the hopeless. That is what Hospitals for Humanity is all about. Our impact so far is we've been able to do over 150 surgeries and interventions for the past 10 years. We look forward to doing greater ones. In the heart of the management of Hospitals for Humanity is establishing the first free cardiac center in Africa, which we want to be in Nigeria before we look towards other countries. This is our vision, this is our mission. We are looking at the time in which every kid in the country is able to have access to free surgeries. And this, we believe, will happen by your help, the help of God. Of course, we deeply appreciate all our partners, most especially at this moment, appreciate in Access Bank Corporation for your commitment and the commitment of other donors, sponsors, and partners to our cause. Your support has been instrumental in bringing this success to reality. We are truly grateful for your support, and we look forward to the future in achieving greater milestones together with you. Of course, to the best team in the entire universe, I say thank you for your commitment. Starting from the medical team, you've been hearing a lot of them discussing today. From the cardiologists, we have the surgeons on their side, the perfusionists, the anesthesiologists. They are so great, wonderful set of people. We really appreciate your effort. The administrative staffs, we thank you for all your day and night work in bringing this webinar together and every other commitments you've had to this program. Our Lagos-based team, thank you so much, and the Abuja team also. Your passion has shown to us that even though it's a non-profit, but there is great profit of impact in non-profit, and we are very grateful for that. Of course, one of the things I would like to make mention of today, some of our speakers have said it, I want to make it known to you, if you are not aware before, that you can actually be part of this story. You can also save little hearts with Hospitals for Humanity. So how can I? Several ways, like one of the questions of one of the community pharmacists that was asking today. You can save a little heart with Hospitals for Humanity by, of course, helping someone to identify these defects. Dr. Daniels make mention of something like that. I had a little story recently of a school teacher, a school proprietor actually, that was the one that noticed the sign in a particular kid. And they called the attention of the parents. They were able to take the child for screening, and at the end, it was detected that he has a congenital heart defect. So you can do that. You've had the seminars today, you have those vital information. You can also correct parents who had known their kids with these symptoms and they felt there is no hope. Connect them to Hospitals for Humanity. They can register their kids and they will be on the waiting list for a program. You can also join the awareness campaign team. You have several opportunities. Your phone can be a means of spanning the information. You can use your various platforms to disseminate the information and make it known to others that there is actually what we call congenital heart defects, and the solution is actually here. Another beautiful thing you can do is to donate to Saving Little Heart program. I would like you to know that we are doing this great exploit in Nigeria and Africa, but we ensure that the cost to the parent is zero. That's no cost to the parents. But of course, this can't be done if there are no mindful, willing philanthropists, organizations like the Access Corporation and several others that come together to make this cause a reality. So you can be part of those wonderful people that makes our program to be successful. You can also link Hospitals for Humanity to someone somewhere who you know has the ability and will develop the interest of sponsoring some of these noble cause we do. We will be glad to hear from you soon on some of these strategies. As we close this webinar, you mentioned that in about 40 days' time, Hospitals for Humanity will be back to our normal cause of saving more little lives. We invite you to support our cause to continually transform the lives of these children. Our website is open every time. You can go right there. It's http://hospitalsforhumanity.org. You have it on my slide also, and we can also send it to you at any time you request that. We look forward to seeing your participation with us as soon as possible. Of course, I wouldn't want to stop this brief note without recognizing the vital role the parents played in the care of children with congenital heart defects. Our great praise goes to those parents out there who have their kids in the day, in the night. They cry sometimes, they laugh sometimes, the pains them much. We felt your pains, and that is why we are united in this cause. Your strength and advocacy is part of what drives the mission of Hospitals for Humanity. Thank you for being an essential part of this journey. And with this, I say thank you to everyone that is part of this program today. We look forward to seeing you in our next endeavors. Thank you and have a blessed day.
Thank you so much, Pastor Femi. That was a great way to wrap up. Okay. I want to thank, I think you said it all actually, but thank you again, everybody, for attending. We know you could have, spent your time doing anything else. You may even be at work and you still logged in to come and spend this time with us and to learn this information and to connect with all of us who care about saving little hearts and making children's hearts better in the context of World Heart Day. Mrs. Yoma, you had some more to say.
Oh, yes. We hope that, everything that we have learned today will all just push us to action, right? In whatever sphere that we find ourselves as school teachers. Pastor Kwame mentioned that very, profoundly. I recall many years ago, my daughter, it was also a school teacher that noted that she needed to get glasses. She had eye problems in school and she couldn't see the board. It was in the school that was detected. So every one of us, today's World Heart Day, we're commemorating World Heart Day, and we expect that we should start to pick up the signs all around us. Pick up the signs of a little child that is not able to play like other children. And, you could just be saving a little hearts by doing that.
So we couldn't have done this without our wonderful panelists, without you, our audience, without a wonderful technical team who made all of this possible. So thank you so much for everything. And have a wonderful post World Heart Day and go forth to use your heart for action. Thank you.